Hi, I'm Ed Jacobs, founder of Impact Therapy, which is an active, creative, multisensory approach to counseling. I'm here with Heidi O'Toole, and she's going to demonstrate one of the techniques of Impact Therapy, which is the use of the whiteboard or to make the counseling visual. And this is all going to be related to addictions counseling. Heidi does workshops throughout the country on addictions counseling and impact therapy. You want to say any more? Or?
Well, just the use of words and acronyms in addictions is very effective.
HALT is one.
HALT is one of them. Fear is another one. And we use them, one, because they're simple. It's simplistic. Keep it simple. Because we want to fire off neurons in people's brains who have been drug addicted or that have been impaired for several years. And also, it's about relating to what they're already familiar with. Because the drug and alcohol industry, or in particular the alcohol industry, has used jingles and acronyms and those types of approaches to engage you to buy their product. So I like to use what's familiar to their brains in order to try to market recovery.
Okay, so I'll role play a client that's having...
Just struggling with being able
Right.
to make effective decisions.
Okay, so... I just don't think I'm good at making decisions, or
You haven't had a whole lot of practice. The decisions you've made have been consequential, and
I made bad ones.
yeah,
right?
and so in that
I mean, that one job I lost,
and
I loved that job.
Exactly.
I loved it,
I believe that you did.
and I had a chance of moving up.
But you just didn't have the capacity to make effective decisions to maintain the job. And that's what this process is about. This recovery process you hear us talk about is in order to build your capacity to make more effective decisions. I want to show you something I think would be helpful to you. It's all about making decisions. We've got to get our needs met, okay? And when you were using, you made decisions to get your needs met, to get your drugs, your alcohol,
Well,
to get
they were
high.
bad ones. I lost the job.
They
my
were.
wife. I don't think
You've
I'll
lost it
ever
all.
meet a woman that'll be. I don't know that I'll ever meet someone
Well,
like her.
Like your wife. And
Yeah.
we don't know that, but I can say this to you. We can help you become a more effective decision maker. And whether you meet someone like your wife or not, you can make effective decisions that can put you in a different types of relationships than you were with your addiction. The word decisions. Okay, watch this. The decisions you make, and this is what you're talking about, will determine the direction your life takes. Now, absolutely, that's what we just sat here and talked about. You made some decisions that your life went in this direction, and on the way down, you lost your job, you lost your wife. These are things that meant something to you, you see. So when the process of addiction, if it isn't halted, you lost money as a result, you will lose everything and anything that means something to you. So in order...
How do I get to it?
Yeah, exactly. So what we are going to do is we want to stop this process, because eventually, as we've talked about, if you don't recover, you're choosing literally to die. That's where addiction ends.
I don't want to.
Good. That's a start. That's a start. The willingness to do something different. So what we really need to do is we need to work on building your capacity, okay? We need to build your capacity to become an effective decision maker. One of the things that we need to look at is we need to really get clear, what is it that you want? You want your life to go in this direction or this direction? Okay, all right. So again, the use of the board, using a word, using the directional
it's so powerful,
arrows.
just me role-playing, and then you use... get a plan, and I know you use the WDEP that Bob Wobelding does.
Which is, choice theory, reality therapy, again, a staple, a theory that we use
And
in
you make that
addictions.
visual when you do it.
Absolutely. We write it just like we did here. What is it that you want? So this is, again, it's an acronym. The use of acronyms, keeping it simple. Okay, right brain, left brain processing. What is it that you want? Okay. What are you doing?
You want to put that as want.
Yeah. What is it that you want? Yes. Okay. And what are you doing? Let me get that out of the way. What are you doing? Okay.
Yeah.
So that's what we talk about. What are you doing? I'm still drinking. I'm not going to meetings. How is that? So we evaluate, and that's what the counseling process is about. It's a continuous evaluation. It's an ongoing assessment of taking a look at it, what the client is doing. Is it really getting them what they want? And for most, obviously, we know in addictions it's not.
No.
And so then I tell them the purpose of you being here, or the purpose of this group, because in addictions counseling, we run a lot of groups as well, is to come up with a plan to get you what it is that you want.
For more information on WDEP, you can go to Bob Woboldink's website or just Google the term WDEP and you can read a lot about it, and it's a very effective thing. But just the use of the whiteboard, what we want to encourage you as counselors out there, and especially addictions counselors, make your counseling multisensory. Use extra chairs, use the whiteboard.
Use the board.
Yeah.
You use the props, use movement, get people up, get them to move. And again, I mentioned group, but certainly an individual, but in group counseling, because in the addictions field, the majority of our therapy is in a group setting.
We're going to do a clip on that here.
Okay.
For more information about impact therapy, go to impacttherapy.com.